Thank you very much indeed, Mr. Chairman, and good afternoon, ladies and gentlemen. It's a great pleasure to contribute to this huge success of Diabetes India. Coming to India is a very exciting news for me. This is my fifth time in India, and thank you very much for all your hospitality. Special thanks to Banshi and all the other colleagues from India. Um, I'm not sure if it is a great thing to start a successful session on advanced insulin pump therapy by talking barriers. But it's important for us to acknowledge that for every success, there are challenges. And I would like to highlight some issues related to automated insulin pump delivery in particular, so that we can even cherish any success we have, having overcome those obstacles. And I would like to also say that challenges are not only experienced in India, but these challenges are global, unified challenges and obstacles, even in the top centers in the world. Okay, so there are multiple barriers to successful insulin pump therapy. We can talk about technical ones, we can talk about the economical challenges. There are lots of psychological and behavioral barriers to success of such a therapy. There are regularity and accessibility issues. There are equity and inclusivity, as well as ethical and privacy challenges that we need to overcome so that we can celebrate and enjoy the advanced technology. There is a wealth of data about this particular topic because, as you can see, it's not purely a scientific one. There is a lot of politics in it, and there's a lot of health economical issues. So I just picked few references which helped me to put together this 10 minutes talk. Technical barriers, they do come up as first because they are hands-on and the first encounter when we talk about insulin pump delivery. We all have experienced the use of sensors and we all witnessed the improvement in MARD. However, CGM inaccuracy remains, and it's a very important issue when we talk about developing trust between patients and the advanced technology. Insulin delivery speed is another one. We know glucose is very quick to go in the bloodstream. Insulin is not as fast. I haven't personally used the ultra-fast insulins, which have been available in many countries. Perhaps that could reduce the challenge. Device integration within the technical barrier is a well-known thing, and it's not very easy for most advanced algorithms to prevent that. And regardless how advanced insulin pumps are, insulin pump failure is something that we need to know about, whether hardware failure or software. Algorithm limitations are still there. It's very difficult for any system available nowadays to mimic the natural pancreas, and we experience nowadays the difficulties for the automated boluses or the basal if the patient did not announce meal. Comprehensive education and support is critically important as community-based resources. We have recently finished up a crossover study looking at the importance of intensive integrated telehealth as an adjunct to education, which showed very good results. So colleagues in the previous symposium were talking about education, and I cannot agree more with that. Then, as us diabetologists are witnessing the advances, we would like to ask our colleagues, mathematicians, to improve their algorithms as well, because we need to combat these challenges. Cost comes up at the list whenever we talk about technology and diabetes, and it's not only the cost of buying the pumps, but for also funding their consumables and their maintenance. Insurance is a battle, wherever we are, and whatever we talk about in the field of diabetes. This is a survey that we have completed recently, and I'm very pleased that I had colleagues from the Indian Society as well, 35 of them, who replied to this survey. We were talking about what the gaps are in having better technology spread amongst the world. And it's interesting because 70% of respondents said that money is not only a reason, but it's the main reason that we are having gaps in applying technology in treatment of diabetes. So we need better insurance, better medical coverage, better dialogue between us and other stakeholders, including insurance people and policymakers. There were lots of talks during this conference about mental health and coaching and education and empathy. There are many words that we have heard. There is a lot of issues within families and people living with diabetes about hesitancy and trusting the system of the automated blood sugar. It's quite hard to have a piece of a machine sort of managing the diabetes, going through algorithms and AI, and people go through a learning curve. It needs overwhelming amount of education and training. Those of you who are clinicians witness how difficult it is to send this message across to those people who rightfully have lots of psychological issues. The insulin pumps and CGMs as well, whether we admit it or not, do impose some difficulties on these children. They are great in managing blood sugar, but they can be at times intrusive or uncomfortable. Now, having smaller pumps is great. Having tubeless pumps is great, but we need public awareness to make people feel that this is normal. It's normal to have a device. It's normal to use automated insulin pump delivery or insulin delivery because that's an advanced way and the only way to reach to the stage of the artificial pancreas. I think it's the right venue here in India and other areas in the Middle East to talk about regulatory and accessibility. In Abu Dhabi, we face, while it's quite a rich country, but we do have a lot of issues getting approvals for insulin pumps. There is delay. Insurance people always oppose and try to save and putting pressure on us, diabetologists, to justify every single request that we have. The regional availability is not the same. Sometimes we have patients from other parts of the world. We cannot even download their data because the systems are different and the standards, interoperability standards are different. Equity and inclusivity barrier. This is a very important area that it needs time that we talk about. Access is a major issue. So even in countries like mine, Libya, that's where I come from, and others, India, even if people can afford the provision of these expensive technologies, sometimes access is not easy because it's not about shipping a pump in a luggage and bringing it from another country. You need the whole system, the customer care, the proper support from the manufacturing pharmaceutical company. Ethics. This is my preferred area. I chair the research ethics committee in our medical city, and we always get stuck in approving projects related to technology because of the expansion of AI and the different cybersecurity issues. And this has proven the case not only in research, but also in clinical practice, because there are data transfers, data storage, data sharing, and this is always difficult that we need to understand that the patient consented to the data he or she is providing. Algorithm bias is another problem. So we collectively, amongst these barriers, we need to address these systemic or biases, and we need to ensure that AID is now a universal option. That means we need to tackle the access issue. Promoting cultural competence among healthcare providers is very important. So having conferences like this, having collaboration between producing pharmaceutical companies and educating the educators of healthcare professionals is something incredibly important. So at the end, ladies and gentlemen, I don't know how to conclude because it needs a huge concluding statement on how we can overcome these barriers, because there are plenty of them, and I don't know how to concentrate my conclusion in one of them. Shall I talk technical or economic or psychological? Perhaps we concentrate on access or equity, and we need not to forget always the ethics. So we need to come together, identify correctly who the stakeholders are, starting with patients living with diabetes and their families. Then we come next as healthcare professionals. And there was a statement mentioned in one of the plenaries today. That is, it's not fair to leave the diabetes care for diabetologists only. That's a huge burden. The government should come in. Insurance companies should come in. They are not our opposers. We should work together to provide what people living with diabetes deserve. And I'll stop there, giving you 3 minutes back. Thank you very much.